various reasons for not being well. Yeah, got other things. So let's start with something. Okay. So I thought I will explain 5 questions for you. Okay. So 5 previous year's questions. So the subject that we are going to deal with today is 5 questions with you. Okay. Because you said, ma'am, you're putting up questions, but then there's no discussion. Okay. So first thing is prevalence rate. Now prevalence rate, although we say is a rate, is a ratio. Okay, because number of people by number of people, right? So what is a prevalence rate? Okay, so I'll just give you a very analogy first so that you understand what it is. The difference between incidence and prevalence. Okay, now let's say we are just entering into a mall. Okay, and let's talk about all that beeps in that that entry point. You have a scanner, right? And every time you step, pipping, pipping, pipping. Okay, so if we only consider the number of pipping, okay, that ting 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 sound, that is incidence. Okay, so whoever steps into the mall is going to give an alarm. So by that I know, okay, these many people have entered into my mall, right? So same thing is incidence. So the number of new cases, okay, the number of new cases in a specified period. Okay, so let's say today what is my incidence? So today how many people have stepped into my mall or into my theater? So count how many beeps I'm hearing. So that is my incidence. You understand? Now what is prevalence? See, not all of them who entered the mall, we're going to stay there for, we're going to stuck there in the mall forever. No, we might be there for some time, we might get out for some time, we'll just get out. Okay, so prevalence, somebody suddenly is asking me, ma'am, how many people are there in the mall? Okay, I'll give you a dramatic way to remember this. Now suddenly I'm getting a hoax call. Okay, the police is getting a hoax call. There's a bomb in the mall. Okay, so immediately the police is going to call the mall supervisor or whatever and going to ask how many people are there in your mall, because you have to devise a strategy based on that. So right now they're going to not look at the number of beeps who entered. So now they're going to take a snapshot of whoever is actually there in the mall at that time. You understand? So the prevalence is exactly at that particular moment how many people are there or how many people are having the disease at that particular point. So how is this prevalence going to differ from incidence? The number of people who have gone out, who exited the system. Why would they have exited the system? Now let's say in case of a disease, why would they not have the disease now? Either they are no longer alive, they are dead because of the disease, or they are cured. 2 reasons. So incidence is basically whoever is getting new case, new disease. Prevalence is at that particular point whoever is having the disease. Is that clear? So prevalence rate, coming to your prevalence rate. So the previous year's question was asking you the formula. So that means it is going to depend on the duration of the disease. Okay, so duration and the confounding factors are whether it's causing death, and the influencing factors are whether it's causing death or it is causing or it's resulting in a cure or a recovery. Okay, so prevalence rate is incidence multiplied by duration, the mean duration of the disease. Is that clear? Okay, so why is it considered that India is the diabetic capital of the world? Because we have a lot of prevalence. Why? Because we are able to save all these patients. Earlier diabetic patients used to die, like my maternal grandfather, he died, he was removed from the system. But now I've been alive as a diabetic for, I've been a diabetic more than even the time I was not a diabetic. So we are prolonging the longevity. So chronic diseases, the prevalence will be more. So prevalence rate is equal to incidence multiplied by the mean duration of the disease. Is that clear? Any doubts in this? So shall we go to the next? Okay, so the other question in one particular paper was all I've done. We've done the parametric and non-parametric and means, okay, and non-parametric test with qualitative data, the Neuer, you remember? Okay, so the question is pretty simple. All of the following are parametric tests except unpaired t-test, paired t-test, chi-square test, one-way ANOVA. So can you answer this? A, B, C, D. A, unpaired t-test. B, paired t-test. C, chi-square test. D, one-way ANOVA. Now, if I were to answer this question, okay, although I was the one who taught you, okay, so I will only remember the first day I taught you what I taught you parametric tests, and the second day I taught you non-parametric tests. So the first day I was talking about student t-test, the unpaired, the paired, and the ANOVA. If you remember, analysis of variance. Yes. So the first day I was talking about parametric test, and the first day she was talking about tests and parametric. The question, just change the question with the options remaining the same. I'm just going to ask you which of the following is a non-parametric test. Okay, all except now I changed it the other way around, and now again it's chi-square test. Chi-square test is a non-parametric test because it deals with qualitative data. Okay, guys. Okay. Now question 3. Okay, I'll keep this for the last. Or let's do this. Okay, on performing statistical tests, we got a p-value of 0. Null hypothesis is true just by chance. Okay, just by accident. All right. Is that clear? Okay. So did you understand what it is? Okay. So now let's look at the options. Probability of finding a significant difference is 0.4. No, we are saying 0.4 is a probability by chance. Probability of finding a significant difference is 0.4. No. Correct? Got it? Okay. Option B. The difference is not significant 60 times and significant 40 times. They're trying to tell us the same thing as option A. Option A, we put it as 0.4. Now they're talking in terms of percentages. Again, no. All right. Option C. Probability of declaring a significant difference when there is truly no difference is 0.4. Isn't correct? Yes. See, there is no, what is 0.4? 0.4 is the chance that this is completely by accident. All right. So the probability of declaring a significant difference when there is truly no difference is 0.4. Okay, that's true. Now let's see option D. Power of the test used is 60%. What is this power of the test? You remember that day we discussed about type 1 and type 2 errors? You remember? So type 2 error was something like your dil kehta hai ki mere ko ye accept nahi karna hai. Okay, you remember? See, I am not willing to accept the reality that my boyfriend is. Continue to hold my null hypothesis even though there is nothing to support it. Okay, so that is type 2 error. So type 2 error, and the other one, what is the other one? So if I'm going to reject my null hypothesis, okay, when the findings are significant, that is called when the reality is that the null hypothesis is in reality false, and therefore I reject my null hypothesis. It's a correct decision, na? Correct or not? My null hypothesis in reality is false. What is my null hypothesis? You remember my previous video? My null hypothesis is I'm saying my boyfriend is not cheating. Yes. But in reality it is false. In reality that means he's cheating. Yes. And I get significant findings, okay, to support my null hypothesis. So I get some false findings. That means I'm getting not a true finding. Some finding I get to support my null hypothesis. But I know the reality. So what I do, although I get significant findings to support my null hypothesis, I reject my null hypothesis. I'm a smart woman or not? Yes. Now I'm a smart woman because I have taken a zarur aangi. Okay. So this is already evening for me. No, I had my evening coffee, so I feel like it's already evening. Okay. So power of the test. So power of the test is the correct thing. That is when you're rejecting the null hypothesis. Okay. When you're rejecting the null hypothesis, although you have findings to support your null hypothesis. Okay, so that is the power of the test. So here they are saying power of the test is 60%. No, the power of the test here will be only 40%. All right. Okay, so that is also false. So the correct answer is option C. Okay, ये थोड़ा घुमा घुमा के it's more of an English. Okay, a little bit of English and little bit of common sense you'll have to combine together to get your answer. Now another question, fourth question was about relative risk. Now relative risk formula, guys, it's so easy, especially in the context of COVID. Now we've been through COVID, it's so easy. I'll give you an example. Okay, now let's say I am okay, all of you are medicos. Okay, you are all seeing COVID patients. So you are exposed to COVID, okay, unlike someone like me right now sitting at home. I'm not exposed to a COVID patient. So the incidence of you and I getting COVID, yes, the risk or the comparison between you and I getting COVID, that is relative risk. Did you understand? So that means the incidence in exposed divided by incidence among non-exposed. Got it? Yes? Okay. So one thing, what are the options that they have given? I had not written it and kept. One second. Let me just go through the options that they had given. What are the options? Okay, so now this becomes a big option. Okay, all these big options. Incidence of disease among non-exposed divided by incidence of disease among exposed. Incidence of disease among non-exposed minus disease among exposed. And the ulta one, exposed divided by non-exposed. Okay, so it's like exposed and non-exposed unka ratio hai. Okay, so now it's more about whether I'll tell you what are the things that they are testing you on. One is your ability to read long options. Okay, and when the same words keep repeating again and again in 4 options, don't you think mind is little numb looking at that? Basically, you have to know this concept in your mind and just look for the options. Okay, and see, is this matching with what you have in your head? So we know it is incidence among exposed you divided by non-exposed me. Clear? Association. This exposure to COVID patient, does it actually have a bearing on me developing? Everybody knows the formula. Now they will ask you, give you the relative risk is what is a value. So now interpret. Now if it is 1, so that means whether you are seeing COVID patients or you're not seeing COVID patient doesn't make a difference. Understood? No difference at all. So there is no association. Number 2, 1. Let's say it's 1.2 or 1.5. That means you are at higher risk than me who is not exposed, sitting comfortable at home. Understood? Simple, no? Exposed में numerator में ज़्यादा value आ रहा है. That means there are more cases among the standard only. Now let's say among doctors who are treating COVID patients, let's say those who are fully vaccinated and partly vaccinated. Okay, so let's say when we are comparing the incidence between these two people who are fully vaccinated and partly vaccinated, okay, and the relative risk is let's say less than 1 among those who are fully vaccinated. So fully vaccinated by partly vaccinated, you're getting a value of less than 1. So what does it mean? There is lesser incidence in the numerator. Among the fully vaccinated, there is lesser incidence. So that means the vaccine is protective. Do you understand? You understand? So you have to read a little, extrapolate it and apply your thought process into that. What thought process? Just common sense. Okay. So basically relative risk equal to 1 means there is no association. Relative risk more than 1 means a stronger association, and relative risk less than 1 means something is protective. Now, for example, I forget actually the exact relationship. In ulcerative and Crohn's disease, somewhere, no, smoking is protective, something of that sort you have in one. So just imagine yourself, okay, you go back and check the truth, and also what is the fact, you read that in your Robbins pathology, and also now come back and work out the relative risk. What would it be when it is a risk factor? What would it be if there is a protective role? Okay, got it? Okay. Now, the last one is about the Pearl Index. Now, first of all, what is this Pearl Index, man? Pearl Index is how efficacious that method of preventing pregnancies, any of your contraceptive measures, how good or how efficacious they are. That is Pearl Index. Uh, 1 second, guys. Just hold on. Okay, so it only tells us what is that? I was talking about Pearl Index. So it tells us how many times this contraceptive method has failed. Okay, but in per 100 women years. Now this per 100 women years is not something like very high-fi. I remember doing all these ratios and proportion wala questions. I think when I was in class 6 and 7, we used to talk about man hours of work. इतना इतने लोग ने इतने घंटे में ये काम खत्म किया, तो अगर मेरे पास 100 लोग हैं तो ये लोग इतने घंटे में काम खत्म किया. वही काम अगर मेरे पास 50 लोग हैं, वो कितने घंटे में काम खत्म करेंगे. बस द सेम थिंग. ओके, सो यू गोइंग टू यूज दैट. So there is a question. 100 females were surveyed for their OCP use, okay, oral contraceptive pill use, for 24 months. So how long are we surveying them for? 24 months, which is 2 years. So how many woman years do I get now? I'm doing this, conducting this survey on 100 women for 2 years, 24 months. So with me, I have 200 women years, 100 times 2. Okay, and of these, 10 people became pregnant. Okay, so what is the Pearl Index? So Pearl Index, 1 second, I've written and kept. Okay, I've done my calculation and kept, because otherwise I goof up. So मेरा ये कहना है कि when I have कितना 200 women years, okay, 200 ना, yeah, 200 women years, we have 10 failures. How many became pregnant in spite of using OCPs? Means failures, no? So 200 women years, I have 10 pregnancies. So that means for 100 women years, now my teacher used to teach me like this. Okay, I had one Mrs. Mary. She's always, but itna means itna means kitna. Okay, and then we used to cross over like this and do it. So I did the same thing now. So that gives me 100 into 10. This is my Pearl Index. Remember her, she's been like so petite at that time, and like do this. So I did the same thing now. Okay, got it, guys. So 22 my contraceptive method. So for 100 women years, kitna? Because Pearl Index talks about per 100 women years. So that means, again, I'm telling you 100 into 10 divided by 200, which gives me 5. So is my Pearl Index for this question? 5. So I have effectively discussed today over a period of 20 minutes, 5 questions. Okay, chalo, bye. I'll back later. More questions.